Good morning, good afternoon, good evening, everybody. Thank you for joining. I try to keep speaking so that you can check your sound and then also you can check the screen to see if you can see the webinar properly. Right now that you should see the blue screen with the countdown, which is about 15 minutes, and then hopefully that you can all hear me well. Now that 15 minutes to go, we have enabled the YouTube live streaming. So if somebody cannot log into the Zoom, please tell them that this YouTube channel of FAO so that they can follow our webinar through YouTube. The chat box that the URL is introduced, so you can use the address to send to your colleagues. Thank you. Now that we have 355 people joined, I have been telling people to share with us who you are and then where you are from, where you are connecting from, so that we will be able to network together, and then I can introduce from FAO conference room. I see FDA Philippines, so welcome to the conference. Welcome everyone. Somebody is asking how to change your username. That is tricky, isn't it? You can go to your profile from the setting icon and then you can change your name. And if you cannot find the setting, then you can just write your name in the chat box and then telling us that where you are connecting from so that I will be able to introduce you to everybody. Hi, once again, good morning and good afternoon and good evening, everybody. Greetings from Bangkok and FAO office. I am seeing some questions on the Q&A box, so I would like to brief you about the Zoom functions. But then please don't write the questions yet in the Q&A box because it will be very difficult for us to answer all the questions before the webinar starts. So now that we see that the Q&A section that we have only one question that we are having is saying that are we going to have a recorded video of this conference? And then answer is yes. So YouTube is already live streaming, so this file will be available to everybody. So the link is already shared in the chat box if you would like to see those link, and then you can watch the recorded webinar entirely. We have 4 different sessions, including today's session. All of them will be recorded. Right now that all the attendees do not have the microphone and the video settings, so you won't be able to show your video or speak unless that there is an opportunity for the discussion. So first part is that the speakers will have the microphone and the video. So at this moment, if you have any questions, any comments, please use the chat box. And then during the session, please use the Q&A section. You can mouse over the screen and you will see the menu at the bottom, and then you will see the Q&A box. Don't write anything yet, but then please use that box to ask any questions, please. Then for the Q&A box that I would like to explain, so if you have some time to spare, please click on the Q&A box so that you'll be able to know the functions of the Q&A box. If you click on the Q&A box, one window pops up, and then you will see 3 tabs. The far left tab has open on the top. And then that is the question that you can see. And then that is the question that you can write. And then for the panelist, we will see another tab. And then panelists can answer the question. So this is how it works. So during the session, please use the Q&A box and then see open questions and then answered questions, so that you can see that if anybody else in the participants may have the same questions that you may have, and then your questions may have already answered. So that's how you use the Q&A box. If you would like to greet your participants, then you can use the chat box to greet the participants. Many of you are already doing it. Greetings from Malaysia, greetings from Laos. We see lots of countries, Cambodia writing. So that's how you can use the chat box. Now that we have about 5 minutes to go, now that how you use the chat box and then Q&A, I hope that you understand. And then the one audio question was that if you will have the presentation files at the end. The answer is that those presenters who agreed to share the presentation files, we should be able to give the presentation files at the end of the webinar sessions. And then also there's another question that if there is a recorded webinars available. We are now that the live streaming this webinar on YouTube. So basically the YouTube will automatically save this live stream, and then you will be able to see the recorded webinars at the end of each session of the conference. We have 4 different conferences. This is the very first one, and then we will have a second one on Thursday this week, and then next week on Tuesday, the third one, and then Thursday we will have the last conference. Each day has a different themes, so hopefully that you will enjoy the different themes of the food safety and fruitful discussions. Now that I see 2 questions in the Q&A sessions, but then may I recommend you not to use the Q&A box yet, but then I would like to answer two of them. The first one, the certificate. Since so many people participate in the webinar, that it is very difficult administratively from FAO side to identify who participated fully in the webinar. So in principle, it is very difficult to give you the personalized certificates. However, if you need a certificate to submit so that people would understand you use the time to participate in the conference, we might be able to help. So if there is absolute need, please contact us. The next one, that the waiting time, I'm sorry, but then we will be starting in 4 minutes. So do your best. Thank you very much. The last minute, to check your sound. If you hear me okay, then you are good to go. And you see a screen very well, that the time should be ticking. We have about 4 minutes to go. If you can see all of those, then you are good to go. And now my colleague has just shared the YouTube live stream channel on the chat box. So if you would like to see it, please visit the YouTube channel so that you'll be able to understand where the recorded webinar will be stored. In 3 minutes and 30 seconds, we'll be starting. Thank you for your patience, and then see you soon.
Thailand has set a goal to become one of the 10 food production centers of the future. Coupled with the food safety issue, we are therefore well aware that our responsibility is not only for the health and safety for Thai people, but also for all people around the world who consume Thai food. We aspire that not only food is our culture, but food safety will be our culture as well.
The Thai government has strengthened the improvement of food safety system in Thailand. In the year 2004, the government declared the year as a food safety year and approved the roadmap of food safety. Since then, the roadmap of food safety have been implemented along the food chain, cover 5 stages of the food chain, starting from the importing of the food and then control of the food production at the farm level, then control of the food production at the processing and industrial level, and the 4th stage has the control of the food that go to the market, and the last stage is the control of the marketplace, either the domestic market and the export market. Just some year after that, in 2008, the government start the Agricultural Standard Act, and the Agricultural Standard Act cover the setting of the standard and the inspection and certification of the standard. And the main standard cover starting from the farm for the good agricultural practices, and then go to the factory for the food manufacturing practice standards, and then the food product standard. Since 2008, more than 300,000 farmers have been certified according to the standard established, and the food product going to the market also have been certified.
We also have a community consumer protection volunteers who are equipped with medical science knowledge to perform an initial screening test. Thailand had received well support from the FAO through the project on institutional strengthening on food safety and quality control in supply chain management of livestock products, which aim to create collaboration and strengthen the work of the 2 main agencies responsible for meat product, namely the Department of Livestock Development and the Ministry of Public Health, to ensure the safety of meat food products throughout the supply chain, or in another word, from farm to table. We have jointly studied to the problems and obstacles and also identify the solutions to enable us to work smoothly and efficiently. The result of 2 agencies working together with the good support from the FAO is a handbook for control and monitoring meat products throughout a supply chain. This tool can also be used for traceability of the products. Moreover, Thailand works with the FAO in another issue, including food safety information exchange and coordination through the International Food Safety Authority Network, or InfoSan.
We participate in the Codex standard setting, provide comment and data, and also propose standards and data information for setting up the Codex standard.
Good morning, good afternoon, and good evening, probably in many places. Welcome to the Regional Food Safety Conference for Asia and the Pacific, co-hosted by the Food and Agriculture Organization of the United Nations and the Ministry of Public Health, Government of Thailand. Colleagues, ladies and gentlemen, I'm very pleased to welcome you to join this conference. We already have more than 400 delegates online, and this is a sign of the enthusiasm that is there in these times for food safety and to know more about it. When we had initially floated the idea of having a conference this year, we never knew that we would be in this situation. And the first thing that we need to say to all of you, we hope all of you are safe and healthy, and so are all your loved ones. COVID-19 has cast a big shadow, and that actually has resulted in this conference first going virtual, and secondly, try and grapple with some of the key topics that COVID-19 has brought to the forefront. Therefore, we have this conference in 4 parts, and these will be on 4 different days. So the first one is day 1, and we will start with the role of the government in food control. And we have some high-level experts who will talk about how governments use their food control systems to look at food safety issues and protect public health and enhance trade. On the second day, which will be day after tomorrow, on Thursday, we will talk about how science underpins food safety and talk about the evidence required for food safety actions and risk management. On day 3, which will be next Tuesday, we will talk about trade, industry, and standards and small-scale farmers. This is critical because trade is very important for the Asia-Pacific region and has fueled the economic growth, which has made this region the economic engine of the world for the last 2 decades. And the road to recovery from COVID and then on to the SDGs will lie through this recovery once again. And on day 4, we will look at some topics which have come into the fore, not just this year, but over the last few years. The coming to the fore of fake news, of fact-checking, and how do we actually get reliable information. And then we'll also talk about risk communication as well as on capacity development in the long term. So we have a very interesting series of talks and panelists that you will hear over the next 4 days. And we hope that you will keep joining us in the numbers that we already see. So thank you very much for joining again. I will now invite Mr. John Jin Kim, the Assistant Director General and the FAO Regional Representative for Asia and the Pacific, to please deliver his opening remarks. Over to you, Mr. Kim. 4 days.
Good morning and good afternoon, Excellencies, distinguished delegates, ladies and gentlemen. On behalf of FAO Regional Office for Asia and the Pacific, let me extend a very warm welcome to you to the Regional Food Safety Conference for Asia and the Pacific. I wish to thank the Ministry of Public Health, the Government of Thailand for hosting this event. Usually, we organize such an event over 2 or 3 days in Bangkok, with most of you attending in person. This year has been very unusual, as we all know. The global population is in midst of serious health and socio-economic crisis, which caused by the infectious disease, the COVID-19 pandemic, and we are now organizing this event in virtual mode. Given that we cannot meet in person, we are organizing this event in 4 days, as Sridhar just mentioned, spread over 2 weeks on a virtual platform. This will allow participants across various time zones gather together with great convenience. From the outset, let's note that there's no direct linkage between COVID-19 and food safety. Yet, the pandemic has impacted the business of food and agriculture in many ways. And these have been documented extensively by FAO, our sister agencies, WHO and OIE, and many other international organizations. On one hand, the pandemic has elevated the concerns over food safety. But on the other hand, it has increased awareness of food safety and encouraged widespread adoption of good hygiene practices, such as hand washing, reducing touch of surfaces, distancing between workers, and the use of personal protective equipment. This occasion is ripe, therefore, to take advantage of this heightened awareness and pitchfork food safety to the front and the center of efforts to achieve zero hunger or SDG 2. And it allows us to build on strong foundations. In 2019, two high-level global food safety conferences organized by FAO, WHO, and OIE, together with the WTO, World Trade Organization, highlighted how unsafe food poses a constant threat. Instead of providing nourishment, unsafe food has the potential to cause disease and death. Achieving SDG 2 is not simply about providing adequate food for everyone, but also ensuring safe and nutritious diets for all. It's clear that the lack of hygiene and the presence of a parasite are two major causes of foodborne illness in Asia and the Pacific. Antimicrobial resistance is emerging as a major threat as well. If systematically implemented, food safety measures can ensure that 1 in 10 people in the world will not fall sick due to foodborne causes. That could probably save up to 95 billion US dollars annually in low and middle income countries. When I think about the difference that these savings would make to the region, especially when most of the countries have to first mitigate the profound economic impacts of the COVID-19 pandemic and then reset our course to achieve the SDGs, then the economic importance of food safety become even more evident. Another big reason for investing in food safety is, of course, trade. The largest global producers of some key commodities like rice, pearls, oilseeds, millets, sugar, milk, fruit and vegetables, fish, egg, are all in this region. This big volume in the supply chain need to be managed safely. These commodities are exported globally. Meantime, Asia-Pacific region is importing more food as well. Food chains now span continents and countries, all with varying level of food control, and hence the importance of adopting commonly agreed standards like those of Codex, jointly housed in FAO and WHO. Food safety has three principal stakeholders: the government, the consumer, and private sector, including producers. And of course, it must be underpinned by science. It cannot be regulated by one entirely alone because of millions of stakeholders and actors across the food chain in every country. It therefore needs to be based on a judicious mix of regulation, delegation, and participation. That, as you must have noted, is the underlying theme of this conference. We intend this event to be innovative, to incorporate learning from past successes and failures, and importantly, to forge partnerships and harness synergies between and among these parties. This has to be discussed all together because food control can only be as strong as its weakness link. Every food chain actor in every country is important and needs to be involved. Excellencies, distinguished delegates, and ladies and gentlemen, the road to SDG 2 lies through achieving food safety for all. I take this opportunity to invite you all to join the Asia Pacific Food Safety team and to wish you an engaging and stimulating conference. Thank you very much.
Thank you, Mr. Kim, for those very important opening remarks, which have set the tone for this Regional Food Safety Conference. I would now like to invite Dr. Kiatibum Wongkrachit, Permanent Secretary, Ministry of Public Health, Government of Thailand, for his welcome remarks. We would like to thank the Permanent Secretary for his very strong support to the organization of this conference and to the very strong team in the ministry who have made this conference become a reality. Over to you, Dr. Wongkrachit.
And gentlemen, it's my honor to join you in this auspicious occasion at the opening of the Regional Food Safety Conference. First of all, I would like to extend my appreciation to the FAO and all colleagues who jointly organized this important conference. Initially, the conference was planned to be held in June in Bangkok, Thailand. However, due to the pandemic of COVID-19, the conference was postponed and adjusted as a virtual conference in order to adapt to the situation. Ladies and gentlemen, food is one of the most important fundamentals of life. Thus, the availability, quality, and safety of food are the utmost importance. Each year, about 600 million people become sick, about 420,000 people die from the foodborne pathogens worldwide, especially in the Asia Pacific region. About 225 million people fell ill because of the food-related cause each year. Unsafe food doesn't only cause negative impact to health, it also affects to the economy, trade and tourism, particularly in these difficult times during the COVID-19 pandemic. Food hygiene is even more important than ever, both of safeguarding the people's health and the revitalization of economies. As we recognize that the achieve to the sustained development goals, especially the goal number 2, zero hunger. The issue of food security, food safety, and nutrition are interlinked as must be addressed together. The high-level International Food Safety Conference held in 2019, both in Addis Ababa and Geneva, state the importance of food safety in achieving of the SDGs, and government should make food safety as a public health priorities to promote health and productivities and prevent the loss of life through the modern food control system. This conference will be a follow-up to the high-level International Food Safety Conference as we create our way to integrate food safety in SDG 2 in the context of Asia Pacific region. I learned with the pleasure that this conference will cover all aspects of food safety, including how to manage food control system and close the gaps between the sectors and the countries, how to build the capacity for the data collection, surveillance system, and risk assessment, how to manage food safety standards for trade, and how to manage awareness and risk communication in this era of social media. These are all of the key issues that we will learn and exchange knowledge and practice in order to move forward to the achieve of SDG 2 in our regions and ultimately contribute to the world achievement. Ladies and gentlemen, this conference truly provides us a great opportunity to exchange knowledge, share experience, and learn from each other. Food safety needs to be addressed along entire food chain, from production to the consumption. We all have a role to play in making food safe throughout its chains. I wish the conference productivity, fruitful, and achieve all aspects of outcome. I am confident that this was the determination, commitment, and what we have gained from the conference will pave the way toward the achieve food safety for the health and prosperities of our country and regions. Now I will hand over to the moderator again. Thank you.
Okay, are we okay? Thank you, Dr. Ramkrachit. Thank you very much for your excellent remarks and for again telling us the importance of not just food safety, but also the importance of having a food safety culture as well. We now move on to a very special part of the agenda, and that is the launch of the food safety kit for the Asia Pacific region. This kit has been jointly being developed by the Food and Agriculture Organization of the United Nations and the Ministry of Health, Ministry of Public Health, Thailand, as well as a number of many experts around the world who have provided us their expertise and their time to have a set of documents which cover about 10 different topics. Some of these topics are ones which are not usually covered, and therefore we have made the effort to ensure that some of these issues which have now come to the fore and have acquired renewed importance are also part of the toolkit. This toolkit is almost ready. It will be available for all the countries in the region in the next couple of months, and the online version will also be up very soon. I would at this point request the Additional Director General and Regional Representative of the Food and Agriculture Organization of the United Nations, Mr. Jung Kim, as well as Dr. Kiatibum Wongkrachit, Permanent Secretary, Ministry of Public Health, Thailand, to kindly inaugurate or launch the publication electronically by clicking the button which is on your table. Please wait, the launch will come.
Now,
Thank you for the animation, and thank you, Mr. Kim, and thank you, Dr. Wongkrachit, for launching the Food Safety Toolkit. We have now reached the end of the first part of the webinar today. So the formal part, the inauguration, has concluded. And I would like to thank once again all of you for being online early and ready to start the proceedings of the webinar, and to both the Mr. Kim and Dr. Wongkrachit for giving us their time. We all know you're very busy with many other things. Thank you very much once again to both of you. So we now come to what is the business part of the conference. So we shall now start with the first session of the Food Safety Conference, which is about talking about the government's role in food safety. Now, traditionally, this has been an area where governments across the region, the Asia Pacific, have had a very strong hold. And it is very important here to recognize that food safety and food control is a multi-sectoral issue. Many ministries and many agencies have a role and need to play their part. And this is besides what we will talk about later in the session on industry as well as with consumers. So to give us a brief on national food control systems, how they are managed, and especially what are the challenges in the era of COVID-19, we have our keynote speaker, Professor Alan Riley, who is adjunct professor at the Institute of Food and Health, University College of Dublin, and at the School of Food Science and Environmental Health, Dublin Institute of Technology. Let me just say in a very few words that Dr. Riley has vast experience of food control systems, having been the CEO of the Food Safety Authority of Ireland for many years, and has shared his expertise and experience on setting on these systems in many parts of the world. So with that very brief introduction, and we will put up all the bios later, I invite Alan to please start your presentation. Over to you, Alan.
Thank you very much, Sridhar, for those very kind words. I hope everybody can hear me. Let me first of all say I'm really pleased and very honored to have been asked by FAO to make this presentation on food safety systems, a topic very close to my heart. So good morning, everybody from Dublin. It's very early in Dublin. We're 7 hours behind you, so really it's a very early start for us here. Let me begin by just sharing my screen. What I'm going to talk about is really the role of governments in food safety. And I'm going to talk about national food control systems. The government's role is really to establish national food safety control programs to protect consumers' health and consumers' interests and to facilitate food trade. The main responsibility for food safety really belongs to that of the food industry. The government's role is to set standards and to verify compliance with those standards that are set and to ensure that food is safe, food is authentic, and really that will all facilitate trade in food. But before talking about national food safety systems, I would like to just talk a little about the drivers of food safety. Why governments need to invest in food safety control systems. There are many reasons, and we've heard from Mr. Kim, the impact of unsafe food on consumers' health, and also on the economics of trade, the losses to national economies of unsafe food. Protecting consumers' health is the #1 imperative for food safety control systems. Additionally, facilitating food trade is really key. Without a national food safety control program, governments really can't underpin the confidence in the safety and the quality of foods they export. Environmental drivers of food safety, such as climate change, where we're seeing increase in global temperatures and rising CO2 levels, are threatening global food systems. And they have, in a really unprecedented way. To mention just a few of the implications of climate change on global food systems and food safety are things like elevated temperatures, elevated CO2 levels, giving rise to new pathogens in the food chain, things like harmful algal blooms, mycotoxins. This is really the impact we're seeing of climate change. Consumer demographics and urbanization, we're seeing a population that is growing old, becoming more vulnerable to foodborne illnesses. We're seeing more and more people living in urban areas, and the challenges, the food safety challenges to get from the point of production into urban areas, a safe food supply is really challenging for governments. We're looking at evolving food systems, and this is new ways of producing food. We're looking at things like gene editing of food. We're looking at things like nanotechnology, the introduction of new systems for producing foods, which all increase risks, and those risks have to be assessed and to ensure that consumers are not exposed to any new risk from these evolving food systems. Consumer preferences, we're seeing a lot of change with respect to consumer preferences, with respect to eating minimal processed foods, wanting to eat things like organic foods, and so on. All of these are driving the need for governments to invest in food safety control programs. The Sustainable Development Goals will not be achieved if the food supply is unsafe. That is just a fundamental fact. So really key to achieving the Sustainable Development Goals, the food supply must be safe. And how is this done? Well, national food control systems, and I want to talk a little about the key components of these food control systems. The bedrock or the actual foundation of all food safety control systems is a framework of legislation. First of all, national food safety policy and a combination of legislation, regulations, and food standards. These have to be compatible or harmonized with the Codex Alimentarius standards, codes of practice, recommendations, and that's key. But without this type of a framework, a food safety or food control system is really not going to work. I can't emphasize enough the importance of coordinating the operational management between all of the different agencies responsible for food control. Food control is not the responsibility of just one agency. It's spread across many different agencies like health, agriculture, municipalities, local authorities, and so on. And unless there's some form of coordinated management of the activities of all these different players, the system will fail. So that is really key. Risk-based food inspection, again, the methods to verify compliance by the food industry with the regulations, you need to have some form of an inspection program, and really targeting your inspection program where the risks are greatest makes better use of resources. And the risk-based food inspection program, this has to be extended to the import-export controls. Monitoring and surveillance, the collection of scientific data really to underpin your risk assessments, which will be used to make informed evidence-based decisions. So a monitoring and surveillance program is really key to gathering reliable information so that risk management decisions can be based upon risk assessment. And then finally, training and education is a key component of any food control system. Governments have to set standards for training for all food workers, engaging and communicating with stakeholders, like consumers, is really very, very important and a key component of a food safety program. To help member states with strengthening their food control systems, WHO is preparing a new global strategy for food safety, and also FAO is developing a new strategy to strengthen what they have already had on the table for many years. So really, both of these agencies are in the process of developing new guidance for member states to assist with strengthening national food safety systems. A key component, certainly in the time of COVID-19, a key component of the national food control system is contingency planning. And really, contingency planning is key when it comes to managing COVID-19. When you look at the impact on global food trade of COVID-19, we're seeing clusters of illness in workers in meat processing plants around the world. These have been reported extensively over the last number of months. Closures of some meat processing facilities due to large numbers of workers with COVID-19. Restrictions on exports of food from processing plants where clusters of COVID-19 have occurred. And meat processing plants are particularly vulnerable to this particular illness because of the low temperatures, the high moisture content, recirculation of air, and so on, and the close proximity that these workers, are working on processing lines. We've seen closure of catering businesses in many parts of the world due to lockdown and loss of a customer base. If you're a food supplier and your customers were catering businesses such as restaurants and cafes and so on, you've lost your customers, and that's impacting quite seriously on the food industry. The growth in e-commerce and internet sales of food has really mushroomed, over the last number of months, and this is an area where you can get instances of fraud, people selling food on the internet, which perhaps is not safe and is not authentic. So all of these issues are interrupting or disrupting global food trade. When we look at the impact on the food sector, this is the WHO dashboard from yesterday. Over 54 million cases have occurred and 1.3 million deaths as of the 16th, as of yesterday. Now, key is that there's no evidence that the virus is transmitted by food. And this is a respiratory illness, and respiratory illnesses are not transmitted via food, or food packaging material. The evidence that we have to date, certainly the epidemiological evidence that we have over the past 7 or 8 months, would say the risk here is extremely low. Human-to-human transmission via respiratory droplets and contact routes, for example, coughing and sneezing, this is how the virus is spread, and also through contact with contaminated surfaces. What I'd like to talk about are some of the challenges to the competent authorities that are responsible for food safety. Look, working as usual is not an option. We need to identify and prioritize critical areas to work, and we need to focus on those where the risks are highest. That's where we should be, as competent authorities responsible for food safety, that's where we should be working. And as I say, contingency planning, food safety emergency response plans, really doing an analysis of your country level situation and where to focus the resources that you do have to minimize risk from this pandemic for your citizens. If we look at some specific challenges for competent authorities, you're going to have reduced staff resources due to either reallocation of staff to urgent tasks related to the pandemic, or staff going sick. So you're going to see a number of reduced food inspections. And this is really, why you need to focus on identifying those food premises that pose the highest risk and ensure that they don't fall through the cracks. So really, you're going to have to intensify risk-based food inspection systems to ensure that consumers are not exposed to unsafe food. Reduced laboratory capacity. In a lot of cases, we've seen food laboratories are now testing for SARS-CoV-2. They're no longer testing for food samples, a lot of the public health labs. So this is going to cause a disruption to your food inspection program, that you won't have the same capacity to analyze samples. Again, the need to prioritize which samples that you are going to test is really key. And risk to the integrity of the food supply chain from food fraud. Globally, as I say, we're seeing an increase in food in e-commerce, and really this is a huge challenge for competent authorities to control e-commerce. And I know Codex is developing guidelines, and others are developing guidelines on how to, audit, inspect, and control e-commerce, so that consumers, number one, their health is not put at risk, and number two, they're not defrauded. Communication really during the era of COVID-19 is key. And for competent authorities, the provision of accurate and credible information is so important. There's so much misinformation circulating on e-commerce, or the internet, that really the job of competent authorities is to ensure that there's accurate and credible information for consumers, for all stakeholders. One of the best ways of ensuring that you have this accurate and credible information is to establish dedicated websites on your home pages that are regularly updated to ensure that consumers have access to accurate and valid information. Liaising with the food industry, with regulatory updates, with advice on how they can keep this illness out of their food premises. And really, this is key for food safety, to ensure that the illness doesn't enter food processing plants, and therefore it's not going to be spread through food. And I mean, that is really the key. And to ensure things like hygiene, sanitation, PPE, and so on are all in place. Consumer information is also key for consumers to have access to accurate information. This needs to be linked to your public health colleagues. So it really is a national effort, collaboration, across the different agencies to ensure that consumers are informed and they have access to information so they can protect themselves and their families. Really, the take-home messages from what I've said, number one is national food control systems are essential for protecting consumer health, consumers' interest, and facilitating trade. COVID-19 is not a foodborne illness, and I mean that all the evidence points to that particular fact. Occupational health and safety measures are essential for ensuring COVID-19 free food processing premises. So really keeping this illness out of food premises is the success factor. And competent authorities require robust contingency plans for communicating with all stakeholders. And this is really essential during this particular pandemic. What I've said is summarized in these two publications from FAO and WHO. That this is very sound guidance for competent authorities and also for food businesses. The references are here. You can download these from the web, and they're two excellent documents. With that, I want to say thank you very much for listening and pass back to colleagues in the main conference. Sridhar, over to you.
Thank you, Alan, for another great presentation, for putting into context the effects of the pandemic on food business and across the food chain, and some of the impacts on regulatory controls as well. This is critical information for many of the countries in the region. I just wanted to point out that throughout this year, one of the countries in our region, Mongolia, never had a lockdown. It went through the last few months without a single infection, which was very good for them, although the country itself had closed its borders. However, last week, they actually did find local transmission, and they actually had to close down or go into lockdown. So this is a situation which keeps changing all the time. So in that context, Alan, one of the interesting questions that have been asked by one of our participants is what would be the strategy to ease and continue regulatory functions so that to keep both trade as well as food control within a country moving? I know you addressed some of these points. Maybe you could elaborate a little more on them. Over to you, Alan.
Well, really, the food sector is one of those essential sectors during this pandemic. Trying to keep the food supply secure is a huge challenge. Certainly, the developing recommendations for food businesses on how to prevent this illness entering their food premises, and basing those guidelines upon the interim advice from FAO and WHO would be a very good place to start. Those two documents I referred to at the end of my talk actually have information for competent authorities on how to assist industry to keep this illness out of food processing plants. It really is essential to keep the food flowing, the food supply chain, to keep us secure, that it works. And really that is, and also key is to ensure that consumers have confidence that the food is safe, and you don't get things like panic buying that we've seen in some countries. That we can ensure that we can stand over the robustness of the food supply, but really putting together recommendations for the food industry based around the simple factors like increased hygiene and sanitation, all those measures to prevent transmission of the illness between workers, reducing things like numbers of workers on processing lines, ensuring that workers have access to PPE, having things like policies with respect to if workers are sick, they should be reporting that to management, they should be excluded and so on. If you do have a case of COVID-19, you need to have recommendations as to how to clean the premises, to prevent the contamination spreading. I don't know if that answers the questions that you just asked me, Sridhar. Sridhar, do you have further questions, or have I answered that sufficiently to?
Yes. Thank you, Alan. No, indeed it did. And you did elaborate very well on what are the new realities in the food sector. And just to inform all those who are listening that we will be putting the links to the two documents that Alan referred to at the end of the presentation. You'll find it soon on the chat. So, Alan, one of the other things is maybe we can look at it now from the other end, from the consumer point of view. You did stress a bit at the end on being on open risk communication by the regulatory system or by the regulator with consumers, and you've obviously been in that position yourself. And despite the fact, as you also pointed out, that this is not a food safety issue, there is a lot of concern. So what would be a few recommendations that you would give that, and given we are living in the age of social media where everything gets forwarded at the hint at any time, what would be some things that you would actually recommend? Over to you.
Well, I think those agencies in member states who are responsible for food control, you should be establishing, a dedicated area on your website where you put relevant information, for consumers, and you should keep your websites up to date with the evolving nature of this illness. I mean, say consumers can do a whole lot to protect themselves. Simple things like hygiene, sanitation, washing hands, keeping the number of social contacts to a minimum, when out shopping, wearing face masks, practicing physical distancing. And I know this is, in some cases, this is going to be very difficult, where you're shopping in large, urban markets. It's sometimes physical distancing, can be problematic. But certainly, that's the type of information that the competent authorities should be passing to consumers. And also stressing the point that this is not a foodborne illness. Consumers can become really concerned with respect to misinformation that is circulating on the web. So really continuously updating your own website with factual information, linking to websites like FAO and WHO, where you have factual scientific information, and in a very digestible format. I mean, say some of the new communication techniques that both of these agencies are using can be adapted very, very quickly, for your own situations. So I think this is really key to maintaining confidence, also in ensuring that the food supply works smoothly. That is really key. That consumers are not out panic buying. They can see that there is no reason to be concerned about the quantity, the safety of the food supply. Over to you, Sridhar.
Thank you very much, Alan. I would like to pick one question from the Q&A box and then perhaps elaborate a little bit further. That the one person is asking in terms of the situation of food insecurity. So there are many countries who are continuously fighting this hunger situation, and then now this pandemic situation is not really helping, and then they're asking that how they can prioritize the work over the food safety activities in the very limited resource situations. So you have worked in various countries and then you have experienced this kind of situation. And is there anything that you could share with those countries? Over to you, please.
Well, I think when I was talking about contingency planning by competent authorities, I mean, say each competent authority in your own member state, you will be very familiar with your food supply chain, and really it's trying to identify where the most serious risks are in your food supply chain. Doing things like risk profiling of food industries, of food businesses, looking at the risks posed by those food businesses and focusing your inspection programs on those high-risk premises. That's the type of activity that should be happening within your contingency plan, where you have reduced resources, where food laboratories are no longer sampling foods for testing as part and parcel of the overall program. That is going to be a real challenge, because there are certainly key monitoring and surveillance programs that you should maintain during this pandemic. And I'm thinking of things like residues monitoring programs, looking at pathogens in the food chain, and really investigating incidences of foodborne illness is also really key. That where you have a serious incident of foodborne illness, you should make sure that you have resources to investigate and control such food instances. It is for countries who have limited resources, food safety systems, putting national food safety systems or programs in place is a huge challenge. And really what's happening now during this pandemic, it is even a greater challenge for you. But I think if you can, in your contingency plan, if you can focus on where the risks are most critical and focus your controls in those areas, that's the only advice that I can actually offer. Back to you, Masami.
Another question, sorry, thank you very much, Evan. Then another question that I can pick from the participants is that this very much of this topic of the risk-based ideas, that what would be the government role to involve all the different stakeholders in terms of taking the decisions based on the evidence or risk? What is the first step for the countries who are just beginning to do this risk-based management of food safety? Over to you, Alan.
Okay, well, involving all stakeholders, I think it was Mr. Kim, the ADG of FAO, said in his opening remarks that food safety is a shared responsibility, and certainly involving all stakeholders in the food chain, in finding solutions is really key. I think what needs to be done is for competent authorities with responsibilities for food safety to lead the way. When it comes to risk-based food inspection, the fact that you're going to prioritize food premises according to risk, this has to be done on a collective basis. It has to be done in an open and transparent manner. If you're putting together a risk-based food inspection program, in developing that, you would be strongly advised not alone to work with the various competent authorities across the food chain, but also to work with the industry to explain to them exactly what is going on. Risk-based food inspection will also assist food processors, because if they put in place all the required and necessary food safety management systems, they have documented things like HACCP programs, they have good hygienic practices, you have all the prerequisite programs for HACCP in place, you will reward them by having a reduced frequency of inspection. They don't pose the same risk as a food premises that would not be paying attention to all of these different management systems. So really key here is to involve all stakeholders when it comes to developing these programs, that they understand exactly what it's about, they can understand the rationale for the programs, and they can also understand the benefits that they can get from investing in food safety management systems. I hope that answers the question. Massimi, over to you.
Yes, perfect. Thank you so much, Professor Alan Riley. So I will return the microphone back to Sridhar.
Thank you, Alan. First of all, for being here with us at so early in the morning for you, and for giving and sharing some really good advice on what food control systems and competent authorities need to do in the time of COVID, and of course, for emphasizing the key elements of food control systems. So thank you, Alan. So we will, of course, be continuing our conversation with him. So all of you who are interested in asking questions, please do put in questions addressed with his name on the Q&A, and then we will take them up in the discussion which will happen shortly after the presentations which are due right now. So after having heard from Alan on the broader picture, on the higher level picture of food control systems, what are they based on, and how they need to manage risk in food control across in the countries. We will now move to a specific country example, and that is Bangladesh. And to talk about control of food safety and quality in Bangladesh, we have Dr. Shah Mahfuzur Rahman, who is the head of the food safety unit in the Institute of Public Health, Moakhali, Dhaka, part of the Ministry of Health and Family Welfare. And we would like actually to give a very special thanks to Dr. Rahman for taking this up at very short notice. As I mentioned a few minutes ago, we had a lockdown in Mongolia, and where we had a speaker from there to speak right at this juncture. But unfortunately, due to a lockdown and because she is responsible for the food security in her country, she now has to manage essentially ensure supplies of food to citizens in Mongolia. And therefore, Dr. Rahman was very kind enough to step in and agree that he would move in here on the first day instead of he was previously scheduled to speak on day 2 and Thursday. So with that real big thank you to Dr. Rahman, I turn it over to you.
Thank you, Sridhar. Colleagues, ladies and gentlemen, good morning, good afternoon, good evening, and greetings from Bangladesh. You know, the food safety is a shared responsibility, as we heard from the very beginning. And before going to this, I'd like to share my screen. Can you see my screen? Hello?
I can see your screen.
Oh, thank you. Can you hear me clearly?
I can hear you clearly here in Australia.
Okay, thank you. The government of Bangladesh is well committed to ensure safe and quality food for the consumers in the home as well as abroad. And Bangladesh is a developing country with 8 divisions, 64 districts, and 492 sub-districts, and 12 city corporations, and more than 300 municipalities across the country. And in Bangladesh, the food safety and quality control activities are being conducted by some 15 ministries, and there are some 20 agencies, and led by the Bangladesh Food Safety Authority, the apex body in the country. The Bangladesh has enacted the Food Safety Act 2013, repealing the age-old ordinance of 1959 to ensure safe and quality food of the consumers. In 2015, the government constituted the Bangladesh Food Safety Authority under this act to regulate, coordinate the activities of the stakeholders across the food chain. As I have already mentioned, there are a number of ministries and their agencies are working for the food safety and quality control activities in the country, led by the Bangladesh Food Safety Authority, that is BFSA. Apart from the government agencies, there are a number of non-state actors like the consumer groups, civil society, private sectors, professional bodies, academia, research organization, industries, and others. As I have already mentioned, the number of ministries are working in the areas. If we categorize the works in the laboratory service, food standard formulation, institutionalization of the food safety, foodborne disease surveillance system, inspection, markets and street food producers, and consumers awareness. The each ministry, in each activities, more than one ministries are working in the different areas across the food chain, and the coordinated and regulated by the Bangladesh Food Safety Authority from the very production to at the consumer's plate. As I already mentioned, that under the Act, the Food Safety Authority has been established in 2015 with the vision of to ensure safe food for life and health. And the key mission of the Food Safety Authority, formulation of the science-based regulations, monitoring of the food safety activities across the food chain, as well as coordinating the activities of the different organizations. The authority is headed by a chairman and supported by 4 members for different areas of the food safety. And there is a National Food Safety Management Advisory Council headed by the Honorable Minister, Ministry of Food. And there are a number of technical committees, scientific committees to support the authority. And these committees are constituted from different agencies, academia, researchers, private sector, food business operators, industries, and others. If we see the areas of activities of the Bangladesh Food Safety Authority, the key areas are enforcement, compliance and monitoring, laboratory services, food laboratory networking, standard setting, quality assurance, risk assessment, risk communication, and corporate services. So the main activities of the Food Safety Authority is the coordination and regulation, harmonization, food standards, guidelines with the overarching Food Safety Act 2013. As I already mentioned, the food safety activities is run by a number of ministries across the food chain. As you know, there are number of building blocks, important building blocks for the food safety and quality control activities. The laws and regulations are one of the important of them. In addition to the Bangladesh Food Safety Act 2013, there are a number of acts, different ministries and for their activities. For the BSTI, Bangladesh Food and Standard Institution, Livestock Department, Fisheries Departments, Agriculture Extension, there's import policy order, export policy order, there are a number of acts to run the activities. And the food safety authorities, based on the evidence, they have already developed some primary legislation, secondary legislation, and course of practice to ensure safe and quality food. With the dynamism of the Bangladesh Food Safety Authority, after their establishment, a number of laws and a number of regulations have been developed, including food safety rules for food seizure and administrative system, labeling, food sample collection, testing, analysis, use of food additives, contaminants, toxin, harmful residues, food hygiene regulation, food safety, food contact materials, and a number of guidelines have already been developed, and a number of regulations and guidelines are in process as well. After the launch, we have to consider the food standards for the building block. For food standards formulation, Bangladesh Standards and Testing Institution, that is BSTA, is the mandated institute for food standard development and other commodities as well. BSTA is the Codex National Contact Point for the country and also the ISO member. In the meantime, the BSTA has developed, adopted some more than 600 food standards guideline methods. Of them, around 350 are guidelines and methods. So far, 150 Codex standards and methods and guidelines, and 156 ISO standard methods and guidelines have been adopted. The food standard formulation is moving towards the risk-based food standards for the country. The laboratory services. Across the country and under the different departments, not only the public, also in the private sectors, there are some 50 laboratories working across the country. And a number of laboratories are accredited for their different parameters. The laboratories are National Food Safety Laboratory under the Ministry of Health and Family Welfare, Food and Bacteriology Division of the BSTI. There are laboratory under the Ministry of Science and Technology, Ministry of Agriculture. There are also laboratory under the Agriculture Division. And Ministry of Fisheries, there are a number of laboratories. There is also a laboratory network is in place, which is coordinated by the Bangladesh Food Safety Authority. I would like to mention the National Food Safety Laboratory, which is a laboratory equipped with the state-of-the-art equipment, highly trained staff are there, and more than 80 reference test methods have been developed. And it was started operational in 2012. It is an accredited laboratory for its different parameters. So with this laboratory, you are getting the reliable data on food hazards and risks. Now the inspection. In Bangladesh, the food inspection is being conducted by 9 ministries and their agencies directly. And Bangladesh has introduced the risk-based food inspection, which includes the risk categorization of the food businesses, a risk-based inspection plan, risk-based food sample collection. Under the Food Safety Act, the Food Safety Authority has designated the different inspector working the different agencies as the safe food inspectors. The local government areas are inspected by the inspectors from the city corporation and municipalities, and the remaining area are covered by the inspectors from the Director General of Health Services. Importantly, there is a web-based reporting system under the diseases using the DHS2. They report daily for their food safety, food inspection activities. There is some good best practices which has been initiated by the Bangladesh Food Safety Authority with the close collaboration with the local government in the Dhaka city. It is actually it's in pilot process for grading of the restaurants. You have seen in the screen there are grade A plus, A, B, C, based on their different key criteria, and they routinely monitor and inspect these restaurants whether they are keeping their grade or not. So it's a good initiative from the Bangladesh Food Safety Authority with the support of the local government. The street food. Street food is a challenge across the globe so far. We have developed some card to distribute among the vendor. We have also upgraded this card in given time and distributed some 7 urban areas including Dhaka, Khulna and Borishal. The vendors are also trained so they can become self-reliant on their activities. There are some scouts, school children are also looking after these vendors for their food safety issues in some part of the country on a pilot basis. Regarding the primary production, we have developed food safety guidelines, trained the farmers in different tiers, as well as developed the awareness development materials to improve the product quality and safety in the horticulture, poultry and fisheries value chain. And definitely we get the impact for these activities. Farmers are producing the safe food, the customers are getting safe food, and also the farmers are getting the better price for their produces. And not only for the domestic market, for the export market, they are also connecting. We are also developing the farmers, particularly the mango sectors. There's the traceability as well as the good agricultural practice certification system developed by the Agricultural Extension Department. As the surveillance, we regularly monitor the chemical contaminants, microbial contaminants, food allergens, pesticide and drug residues through regular survey and sample collection across the country to see the status. For foodborne disease surveillance under the Ministry of Health and Family Welfare, the Institute of Epidemiology, Disease Control and Research, IEDC, is a mandatory institute. It works along with the other institute like the Institute of Public Health. The surveillance are the event-based, sentinel site-based. There are some 10 sentinel sites across the country. The web-based surveillance, there is a strong internet services and web-based reporting system under the Directorate General of Health Services, and they are using the Buzela Health Complex, involving the Buzela Health Complex, and we are also introduced earlier the cell phone-based surveillance. The IDC is the Info and Emergency Contact Point, and to respond to the food safety emergencies or outbreak response, we have the rapid response team across the country at the different tiers of the administration up to the grassroots level, and we respond. The Director General of Health Services, the IDC response along with the support of the Department of the Livestock, Fisheries, Agriculture Extension, in close guidance and supervision of the Bangladesh Food Safety Authority. We are also the international health regulation focal point for the food safety issues, transboundary food safety issues. Director Disease Control of the Director General of the Health Service is the focal point. A number of organizations are involved with the risk assessment under different ministries and agencies. The academic activities, education program for the food safety. Across the country, the 7 institutes are conducting the diploma course for the sanitary inspectorship course for the by the Director General of Health Services and Institute of Public Health. Recently, we have introduced the BSc in Health Technology Food Safety course, a 4 years course under the University of Dhaka. The MPH in Food Safety course is also under process. The Bangladesh Agricultural University conducting a 4 years BSc in Food Safety Management course as well. In addition to the education, academic education, we have the consumer awareness program. We are using the different media, poster, leaflet, and training at the household level. The different non-government organizations, professional bodies are also partner in these areas. The Ministry of Health, Ministry of Fisheries and Livestock, like different ministries and agencies develop their food safety education and information communication materials for public awareness. We are also using the mobile health and e-health for the public awareness even during the COVID pandemic. And Bangladesh Food Safety Authority has developed a number of guidelines, manuals to aware the public. Some pictures are here. And definitely, we have some challenges, though food safety activities are getting momentum to ensure safer food for the consumers. We have yet to fully introduce the risk-based approach along the food chain. We have to accredit more laboratories and their parameters, though a number of laboratories are in process. So these are the challenges for us. And I'd like to conclude to saying that the government of Bangladesh is well committed to ensure safe and quality food, not for the consumers in the country, as well as the consumers across the globe, those who are importing our food items. And with the leadership of the Bangladesh Food Safety Authority, the apex body, the activities are getting momentum with the commitment and active participation of the all stakeholders. Thank you very much for patient sharing. Dhanyabad in Bangla.
Dhanyabad to you, Dr. Raiman, for an excellent overview of the food control in Bangladesh. So, dear participants, what Dr. Raiman has just shown us is an example of a country which is transitioning its food control system from one that was based on end product inspection now to one which is on an approach which is risk-based, incorporates the entire food chain, has a unified authority which coordinates with all the other stakeholders to have food control across the chain. So this is a very interesting case, and I strongly recommend on behalf of all of us here that you should Dr. Raiman is a person with whom you could keep in touch with from all your respective countries to know more about how this change is happening. It's not easy, it's slow, and it's very challenging, but that's what food safety is all about. So, Dr. Raiman, I just group a few questions that we have got from the various participants, and most of these are related to the BFSA. So maybe you could just say a few things about the BFSA. Is it under a particular ministry? And how does it actually manage all its regulatory activities through the system that has just been set up? How does it ensure that the services that it's supposed to provide that that they are being done effectively. So what mechanisms are in place? So maybe overall you could just give us a picture on how the BFSA operates for the benefit of all our participants. Over to you.
Thank you, Sridhar, and thank you for the participant who actually asked me. It's a very interesting question. Bangladesh Food Safety Authority is under the Ministry of Food, and it works actually in close collaboration with all stakeholders, both from the public as well as the private sectors, and they are not keeping themselves, the authority keeping themselves within their activities within them. They have the different technical committees, scientific committees, taking members from different stakeholders, not only the government, also from the private sector, industries, academia, and others. They are also signing the service agreement with different agencies to effectively coordinate as well as supporting their activities to ensure their activities to ensure safe and quality food. And the different organizations and agencies are also doing their monitoring activities, surveillance activities to see how the things are moving, how the actually there is impact, positive impact on the food safety and quality control outcome of the country, foodborne disease incidence prevalence. We are looking after that. So this is how we are actually seeing the impact, how the effectively the food safety authority is coordinating the activities, the food safety activity, food safety and quality control activities across the country. So in short, I'd like to say the food safety authority is well committed, and with the commitment, also commitment from the stakeholders, the food safety authority is effectively managing the food safety issues in the country. Thank you.
Thank you. Dr. Ahmad, so one more question and then we'll go into a break, and this question actually come up again after the break. What about imported food control? So what are the agencies involved and what kind of, how do you actually implement that? Over to you.
Thank you. In Bangladesh, we have the number of airport, seaport, land port. The foods are coming through this port like the other countries, and we have the import policy order. Every 3 years, we review the import policy orders, and at the port, principally the customs official, though as a part of their duties for revenue collection, they along with the other agencies, technical agencies, say Department of Fisheries, Department of Health, Department of Agriculture Extension, Atomic Energy Commission, with their support, they collect the food samples into the designated laboratories, get results, and this is how the import inspection actually at the border. And after coming the food samples within the country, according to the areas I already mentioned, in the municipal areas, the local government areas, the municipal city corporations looking after the food inspection activities, and the remaining areas and by the Director General of Health Services and other agencies. Thank you.
Okay, thank you very much. It was very fruitful discussion. Thank you all the participants to ask all the interesting questions. We have so many questions still staying in the Q&A box. I tried to answer some of those questions from FAO side too, but then of course that we will be answering all the questions in the final report. So if time allows, we will pick your questions and then answer during the meeting. But then if it is not, then you will see the answers in the final final report. So thank you for joining the discussions. Now that I have a pleasure to introduce you the two more videos. In this morning, before the opening ceremony, we have shown this Thailand video, but then we have more to come. We have two more videos to come. And then today that I am very happy to share with you that video from Nepal and Singapore. So we will show these videos, and then during that time we will take a small break, and then we will see you again at in 10 minutes from now, so 11:40 in the Bangkok time, but then you have a different time zone, so hopefully that you can figure out in 10 minutes. So see you in 10 minutes and enjoy the videos.
In the production process itself, in the processing, in each and every step, in the consumption, each and every step, there are some issues of food safety, because in crop production there are use of pesticides, in livestock there are use of some antibiotics and hormones, and in processing there are use of some extra salt or some other chemicals. And also in the consumption itself, the food hygiene is very crucial. In Nepal, the food safety issues are becoming very challenging in the current days. Our constitution itself has provision that right to food is a fundamental right of the citizen. To achieve this, we have prepared food safety policy, which is already promulgated, and we are now in the process of preparing Food Safety Act. We have Department of Food Technology and Quality Control. It is well empowered now with many trained manpower, and we have very equipped laboratories to test the food quality. From the government level also, we are working to ban some of the hazardous pesticides. Different pesticides are already banned. Food hygiene, integrated pest management program, and integrated nutrition management awareness programs are being launched, and also we have prepared a lot of standards, food standards, food hygiene standards. They are being implemented, and that are helping to make the food safe for the consumption. And also from government side, we are trying to increase the awareness of the people for food hygiene, food safety, even the processed food which are not hygienic. We are trying to make the people aware on that. A lot of media and newspapers are being used to make the people aware. FAO is always with us. With government organizations, we are working in very good coordination, because we know we have a lot of examples with the FAO. That a very good example is integrated pest management program, that we have worked together to make the very good production process to the farmers by implementing farmers field school to reduce pesticide in the vegetables and other crops. Recently, One Health strategy is being promulgated, which was drafted in coordination with FAO, and FAO is helping to make the capacity, to enhance the capacity of our technicians, of our officials working in food safety, in food production, and also in food testing.
Ensuring food safety is important for all countries, including Singapore. Ensuring safe food for all gives confidence to our people that the food they buy is safe to eat. To do so, Singapore put in place an effective integrated food safety system from farm to fork, including robust regulatory controls. This system is guided by science-based risk assessment and is consistent with international standards. Because we import over 90% of our food, we work closely with other countries as well as international bodies such as FAO and Codex to ensure the safety of our food. However, ensuring food safety is not the work of the government alone. Food safety is a joint responsibility. It is important that our food industry and consumers play their part to ensure that the food we eat in Singapore is safe. Singapore has made significant strides in food safety in the past decades. One area we are very proud of is our hawker food. Singapore is known as a food heaven. We have a diverse range of affordable and delicious hawker food being sold in clean, modern hawker centers. However, this was not always the case. It took determined efforts by the government in the 1970s and over a period of 10 years to relocate street hawkers into purpose-built buildings which provided access to amenities such as clean water, electricity, and drainage. These hawker centers have allowed our hawkers to operate rain or shine while maintaining good hygiene standards. Today, there are more than 110 hawker centers providing our people with safe and affordable food. A more recent example would be the formation of a central authority, which is the Singapore Food Agency. It consolidates regulatory oversights from 3 different ministries. This allows us to holistically manage the food industry and the food safety from farm to fork in Singapore. Singapore and FAO enjoy a good relationship. Under our MOU, we have collaborated on initiatives to improve food safety and address antimicrobial resistance in the region. For example, we work together with FAO's Regional Office for Asia and the Pacific to develop an FAO tool to assess the capacities of countries to detect and monitor antimicrobial residues. FAO has also been active in rolling out food safety capability building programs. For example, we found the regional workshop on developing national food safety indicators useful and very important. We support the FAO's very important efforts to continue its good work in rolling out food-related programs for the benefit of the international community.
luck, everyone. So that was the 10-minute break. I hope that everybody enjoyed the full videos in Nepal and Ethiopia. For that, I would like to give the microphone back to the moderator, Schroeder, please.
Thank you, Ms. Ami, and welcome back, ladies and gentlemen, to the second half of this, the first session of the Food Safety Conference. So we have been talking today about food control systems, and we are now beginning to focus more on food control systems in the Asian Pacific region. So to continue on the theme, our next speaker is Ms. Lisa Szabo, who is the Chief Executive Officer of the Food Authority at the Department at New South Wales Food Authority in Australia. She will be talking about Australia's food, about the food regulation system in the two countries, in Australia and New Zealand. As many of you would know, both these countries in many ways are a model for the rest of the Asia and the Pacific region, and they set very high standards. And while we heard in the morning about what food regulation actually means, how it can be done in a very challenging country such as Bangladesh, we will now hear about how it is actually being implemented in two countries down under. So I will now invite Lisa, please, over to you. And thank you very much for joining us here today.
Thank you very much for having me. I'm afraid I'm not able to start my video, but hopefully that'll be done centrally very soon. I'd like to thank the organisers for the opportunity to speak today during what is Food Safety Week in Australia. And the theme here is food safety, it's in your hands. In Australia, our governments have asked us to work from home if we can due to the COVID-19 pandemic. So I'm joining this meeting from my home on the land of its traditional owners, the Wongal peoples of the Eora Nation. And I acknowledge the traditional owners of country throughout Australia and their continuing connection to land, sea and community. I pay my respects to traditional owners, their cultures and elders past, present and emerging. If I could have next slide, please. Today, I'll give you an overview of our food regulatory system. I'll outline the three enduring priorities that our ministers have set for this system, and I'll focus on an area of achievement. Could I have the next slide, please? A unique feature of the food regulatory system is that it is a binational system, in that it is one that is shared between Australia, which is a federation represented by the Commonwealth, 6 states, 2 territories, and New Zealand. The joint system creates laws, policies, standards, and processes to make sure that our food is safe to eat. While constitutional power resides with the states and territories, a formal food regulation agreement sets out the objectives and arrangements for a cooperative food regulatory system. And this also has attached to it a Model Food Act, which has been adopted by all states and territories. This agreement was initially signed in 2000. This means that for industries that operate nationally, they have that consistent foundation of having a common food law and primary legislation in all states and territories in Australia. What this system means is that our food laws are not made by parliaments. They are developed and implemented and enforced by a cooperative joint system where a ministerial forum are the decision makers. New Zealand is not a signatory to this food regulation agreement. New Zealand joins the system by a treaty. New Zealand shares food standards with Australia for food labelling and end product standards. However, New Zealand still retains its own laws for the production and processing of food. This treaty is quite old. It was initially signed in 1995. Food standards in Australia and New Zealand are developed by an independent statutory authority called Food Standards Australia, New Zealand. This is done by public consultation. Each of the standards is underpinned by a risk assessment and a cost-benefit analysis. They are implemented by many competent authorities in Australia and New Zealand. I would have to say that the state that I'm from, New South Wales, is unique in that it has one competent authority, the New South Wales Food Authority, that covers the food supply chain from the farm right through to the consumer. The next slide, please. Overall, the system has 4 key aims: to protect consumers' health, to provide transparent, accurate information, and to promote healthy food choices, and also to support a sustainable food industry. The next slide, please. In 2017, our ministers set 3 key priorities for the food regulatory system in Australia and New Zealand. And these are enduring priorities that we are going to look at once again in 2021. The first of these is to maintain a strong, robust and agile food regulation system. While Australia and New Zealand's food regulatory system has largely stood the test of time, its framework is now over 20 years old, and there are opportunities for reform. Ministerial and stakeholder expectations of what the system should deliver have evolved. While elements of the system have attempted to adapt to expectations, change has been reactive and at times protracted. Reforms are currently progressing in this area. This involves a review of the Food Standards Australia-New Zealand Act of 1991 and a review of the other underpinning arrangements and legislation that I spoke about earlier. The reform process is expected to be completed by the start of 2022. The next slide, please. The second priority for the food regulatory system is that it should support broader public health objectives. Almost 31% of Australian adults are obese, and if you include those adults that are overweight, the percentage goes up to 67%. Poor nutrition and food choice plays a role in these patterns of chronic and preventable disease that's associated with obesity and being overweight. It is estimated that overweight and obesity is responsible for 7% of the total health burden in Australia, and it's estimated that obesity alone costs the Australian public $8.6 billion per annum. That's Australian dollars. Various Australian governments over the years have committed to finding new voluntary ways to reduce the burden of chronic disease through improved nutrition. So far, few governments have actually looked at using food regulatory tools, which are amenable for this purpose, to help facilitate industry innovation towards healthier foods and clearer consumer choice. We are just about to embark nationally on one of these regulatory reforms and open it for public consultation, and that is about the introduction nationally of kilojoule menu labelling in fast food restaurants. In Australia and New Zealand, improvements in diet and nutrition offer us one of our greatest opportunities to produce a profound generational impact on human health and on reducing health disparities. If I could have the next slide, please. The third enduring priority set for our food regulatory system is to reduce foodborne illness. In 2017, this country comparison graph on salmonellosis rates was presented to ministers. While countries have different ways of measuring rates of salmonellosis, Australia's rates, which are in red, were notably higher than other similar nations. Ministers wanted this corrected, and Australia now has a foodborne illness reduction strategy with a focus on reducing foodborne illness caused by Salmonella and Campylobacter. New Zealand has its own strategy. The next slide, please. Nationally, we are having success in reducing the rates of foodborne illness, and I would like to talk specifically about the success that we've had in our own jurisdiction, the state of New South Wales, which is the most populous state in Australia. Since 2015, we have focused our efforts on the restaurant and cafe sector. This setting has been linked to several foodborne illness outbreaks over the years, most notably because of poor food handling and temperature control of raw and partially cooked egg items. For example, sauces such as mayonnaise, aioli and hollandaise, spreads such as egg butter, desserts like fried ice cream, mousse and tiramisu, and drinks like high-protein smoothies. A 30% reduction in overall salmonellosis rates has been achieved in 5 years through the education of food handlers, compliance checks at restaurants and cafes, and if needed, using enforcement tools such as prohibition orders and prosecutions. This was done in the face of the challenge in 2018 of Salmonella enteritidis being detected for the first time in Australia in egg-laying poultry flocks. And these flocks were in New South Wales and they were linked to human illness. With regard to foodborne illness notifications during COVID-19, I'd have to say that in New South Wales, my colleagues in health report that there are fewer. Why this is so is uncertain. It could be, of course, that settings such as restaurants and cafes have closed for several months of this year as a response to the COVID-19 pandemic. It could be also that people are physically not going to the doctor. They're opting to see their doctor via video. And as a consequence of not having that physical engagement with the doctor, we're not getting the samples coming through that we usually would. It could also be that with COVID-19 and its emphasis on cleaning and sanitation and hand washing, it is perhaps somehow assisting us with these rates. And on that note, I would like to thank you for attention, and I'm pleased to answer any questions that you may have.
Thank you very much, Lisa, for the very informative presentation. Now that I would like to pick some questions from the Q&A box, but then before that, I have a very quick question about the last slide on the salmonellosis and then other foodborne pathogens, and then also that you have spoken about this imported food control. So Australia is very well organized in terms of the risk-based food safety management. And then how do you conduct the risk prioritization inside of the country, particularly for the imported food control situation? Thank you. Over to you.
In terms of having a risk prioritization, we do have a process that basically it's a flowchart that we're able to apply to every food business in Australia. So most jurisdictions, I certainly know my own jurisdiction in New South Wales has applied that. So all of our food businesses are risk ranked, those that are very high through to those that are low. And our advice to ourselves, as we have 3 tiers of government here in Australia, where we have an activity of audit and inspection, and our local government colleagues also have an activity of audit and inspection. We ask all of us to focus on those high to medium risk businesses, because they're the ones that potentially, if something goes wrong, could cause the greatest harm. And also for people to focus on those that are the poorer performers. With regard to importation, that's the responsibility of the federal government, and there's agencies set up for that. I mentioned our standard setter before, which was Food Standards Australia and New Zealand. They offer advice on risk on the importation of food. And again, if you're a new product coming into Australia, there will be a level of testing that's applied to it. If you pass that testing, then the frequency of testing is pulled back. If again, for example, that same supplier suddenly has an issue, then the testing frequency gets increased again. So that's how we respond on a risk basis to imported foods. And of course, imported foods need to meet the standards that are set in Australia and New Zealand.
Thank you very much, Lisa. Another question I would like to pick up from the earlier question that was asked in general was about e-commerce. So is there any regulations or any discussions happening in terms of the e-commerce of food in Australia? Back to you.
Sorry, I may have misunderstood you, that yes, the e-commerce of food. Certainly during these times of COVID, we have seen a large increase in the number of people who are calling on home deliveries. Again, if e-commerce is very much alive and well here in Australia, all the major food retailers enable people to purchase food online. Their foods are covered by the Food Acts. The difference is coming once again in those food delivery services and what kind of food safety risks do they present. At present, most of those food delivery services are covering very short distances. So in that respect, we're not requiring them to be licensed in any way or to be have special precautions put on top of them. Like any food business, they are regarded as being part of the food supply chain, and those basic rules around cleaning and sanitation, that they do use insulated boxes to deliver their product is very important.
Thank you very much. Okay, so back to Sridhar to move forward. Thank you very much, Lisa.
Thank you.
Very much now from a neighboring country from where we are, so which is Myanmar. And we are very pleased to have Ms. Sabai Thet-Tet-Tu, who is the Deputy Director, Food and Drug Administration, Ministry of Health and Sports in Myanmar. She's also the InfoSan emergency contact for the country. So we welcome her to the regional conference on food safety. And we look forward to hearing from her on the food control system in Myanmar. Over to you, Dr. Sabai.
Thank you, Dr. Sridhar. It is my privilege to be a part of this important webinar. And I'm going to talk about a brief overview of the food safety control system in Myanmar and its national structures of the control systems, and some of the success stories in the enforcement work and the future challenges for emerging trend in food safety of pandemic situation, especially in developing countries. Next slide, please. Next, please. Myanmar's Sustainable Development Plan has three main pillars. One of the strategies under the pillar 3 of goal number 4 says that increased secure access to food that is safe and well balanced reflect the importance of the food safety and commitment of the governments of Myanmar. So how the government does take a role in fulfilling this goal in the country. Next, please. So Myanmar Food and Drug Board of Authority, which is the highest authority and the steering body for food safety and quality, was formed under the National Food Law and is chaired by the Union Minister for Health and Sports and is organized with related ministry, as you can see in these slides. And this Board of Authority governs the overall activities for food safety and quality. And under this Board of Authority, we have the supervisory committees at the different level, that is central, state or regional, and township supervising committee. And they supervise and manage for all food safety enforcement work and activities in line with the policy laid down by the Board of Authority. Next, please. So the National Food Law, which was promulgated in 1997 and amended in 2013, is the main governing law for food safety and quality in the country. We also have other related and supporting laws for ensuring food safety, as you can see in the box under the heading of the other related law. Of course, this is not an exhaustive list of the supporting law. I just present the most relevant supporting law, and you can visit the given link below to see the details of the content of this law. And for a food safety standard, we make reference to international standards, such as the Codex standards, IPPC, OIE, and the ISO standards. Next slide, please. So food safety control system in Myanmar is the multi-agency approach along the food chain. These slides show the competent authority and the enforcement bodies for food safety in Myanmar. It involves several ministries taking a different role in ensuring food safety and working collaboratively toward the common goal of achieving food safety assurance within the country. Next slide, please. Next slide. So the main food safety control works involve the pre-market assessment, post-market surveillance, and the food safety project. And I will elaborate a little bit more detail in my later presentations about these safety projects, and also the food safety education and training, public awareness raising and education, and food safety notifications and alert. And lots of education and training concerning food safety, public awareness raising and education were done through distributions of the IEC materials and pamphlets, the announcement in ministerial and departmental websites, and also posting in the popular social medias like Facebook, because it is very popular in our country, and conducting talk shows in popular TV and radio channels. And according to the post-market surveillance in data of 2015, we found that there is the non-permitted dye, such as the rhodamine B, oramine O, orange 2, and Sudan dye, were found to be adulterated in many basic food categories in Myanmar. So these chemical dyes are primarily used as an industrial dye, but they were misused in food to enhance the color and appearance of the food. You all know that they can cause an acute and chronic health effects in those who consume in a considerable amount. Next slide, please. So with the leadership of a Mandalay City Development Committee and FDA, a project for dye-free market was initiated at the most popular and traded market called Zejo Market, which is located at the heart of the country from 2016 to 2018. It was aimed to provide assurance of food sold and traded in the market is free from non-permitted dye. So with the concerted effort of all related governments and stakeholders, several initiatives of the advocacy, health education, public awareness campaigns were done, followed by the post-market surveillance. And also the findings were given feedback to stakeholders with constructive enforcement. Incentives were also given to those who follow and maintain the status of the compliance. Next slide, please. So 22 different food items were collected from the post-market surveillance, and around 4,000 food samples were tested for non-permitted dye in 386 retail shops. So most collected food items were, as you can see, fish paste, chili powder, pickled tea leaf, preserved fruit, and meat, sausage, and so on. And it was found that 6% of the collected samples were found to contain non-permitted dye. But after repeated health education, feedback, and constructive action taken, and it reduced to 0%. And finally, dye-free market was successfully established over the period of 2-year projects. Next slide, please. Likewise, with the same strategic approach, school canteen project was also conducted from the 2017 to 2019. We can see that the non-permitted dye tested in the pre-packaged food sold at the school canteen were reduced from 13% to 4% over the 2 years period. And I believe that it was accomplished because all stakeholders were actively participated throughout the course, and the key to success is an effective communication and engagement to all stakeholders, including consumer. Next slide, please. So with this achievement I have presented, the country is now making even more of an effort and investment in the areas of ensuring food safety and quality. The content of the blue box are some of the ongoing and future work to ensure the food safety in the country. Of course, there is needs and gaps in the country. As the existing law does not cover the food chain and application of risk-based approach, we need to modernize the food law in accordance with the international best practices. And we also need to establish institutional capacity, strengthen the analytical capacity with public-private partnership, and also need to shift the conventional food safety control system toward the risk-based control system with more concerted effort among stakeholders, and finally, invest in resources. Next slide, please. With all this routine and regular enforcement work and about the food safety, I also wanted to highlight the emerging trend in the food safety area with the COVID-19. So people adapting to the new normal life, and online food shopping is a booming industry accompanied by the food delivery services. And also food small scale and home-based food production is a growing business, and food flow directly from the producer to the consumer. Though the primary responsibility of food safety is in the hand of the producer, however, as a regulatory authority, how can we ensure and monitor food safety and quality in this rocketing industry to gain consumer trust over food safety? And on the other hand, people tend to consume many different kinds of food supplements in order to enhance their immunity because of the influence of the online advertisement over these food supplements. Even sometimes with the exaggerated claims made in the advertisement that some food can protect and prevent COVID-19. So with limited resources of developing countries, it is still a big challenge to properly regulate and enforce to ensure safety, quality, and efficacy of this product. Next, please. So finally, as a regulatory authority, we are like a fisherman in picture. There are many issues in the sea, and how will we detect, regulate, delegate, and engage to attract all the stakeholders to get on board to participate in ensuring food safety? Thank you.
Thank you, Dr. Sabai, for giving a very interesting presentation on how food control is currently organized in Myanmar. We have a couple of questions for you. Let me also inform all the audience that Myanmar currently leads the Codex Trust Fund, which they jointly successfully applied for along with Laos and Cambodia, to strengthen their capacities in codex standards formulation. And thanks a lot to the leadership from Myanmar and particularly from Sabah in this matter. So in fact, a question to you, Sabah, is from the counterpart in Laos, who is asking about how do you control food safety businesses in a specific zone? I presume it means that in a specific area where there are a number of food businesses, how do you go about ensuring that they follow good practices, hygiene, and so on? So maybe you would like to answer that first.
Yes, thank you for the questions. I think is the engagement of the government with the industry is very important in my opinion, because in the developing countries, I think most of the industries are dependent on the government authority in the food safety area. So the principle of the primary responsibility is in the industry is I must say it's important, and this message has to be delivered in the business part and also let them to practice really the primary responsibility for the food safety. So I think the engagement is very important to initiate the food safety for the whole country. Thank you.
Thank you, Dr. Sabah. One more question, if you could just have, because we also know that you are the focal point for ASEAN on the Committee for Prepared Foodstuffs. And so how do you see the engagement with ASEAN on food standards, given that the 10 member states have different levels of food control? And now you're actually part of even a bigger bloc, which is the RCEP, which was formed last week. So how do you see particularly your role, food standards? What are the kind of efforts that Myanmar will have to make as it seeks to increase its footprint in agriculture trade? Over to you.
Yes, thank you. As Myanmar is the part of the one of the members of the ASEAN countries, and we Myanmar also followed the Codex standard. So I think we need to develop and adopt the Codex standard so that we can harmonize and make sure that the standard is in line with the international standards. So currently also ASEAN is in a discussion for harmonization of the food standard in the area. So as Myanmar is following Codex, I think it's not big challenges for us Myanmar to in terms of the standard setting. Thank you.
And one last question before we move to the next speaker. We see a question posed for you. Could you elaborate a bit about the reason for launching the dye-free market project, and how was this actually designed? Over to you.
Thank you. We have a regular post-market surveillance systems, and so as I have presented in my presentation, from the reviewing from the market surveillance data, we see that there is the food dye, the implemented dye are very much increasing. So we have developed the food dye market, a dye-free market project. So it's a long process. First, we need to advocate the higher authority and higher level, and to engage all the stakeholders, including the consumer. We have given a lot of the education, public awareness campaign, and also testing the food sample, collecting samples, and also give feedback to the shopkeeper, and with the constructive enforcement. They are they are becoming aware of more of the food safety. This kind of dye is harmful to the health of the consumer, so they restrain from using such dye in this food. So it's the success, and I think the success is the engagement and the constructive enforcement from the government instead of the punishment approach. Thank you.
Thank you, Dr. Sabai. We will again have more, I'm sure will be more questions for you when we have the discussion at the end after the next presentation. Just to remind all the participants that once we have the last presentation for the day from Nepal, we will have an open discussion where all the speakers, including the two keynotes from earlier in the morning, will also be present. So please keep your questions ready, or please keep asking them on the Q&A as you've been doing so far. So we will try and take as many as we can in the time that's available. And when we run out of time, we will then respond later through the report. So our next speaker is Mr. Mohan Krishna Mahajan, who is the Senior Food Research Officer at the Department of Food Technology and Quality Control, Ministry of Agriculture and Livestock Development in the government of Nepal. So he now will come to us from the point of view of another developing country on food safety and the quality control system there and how they are bringing it together. So over to you, Dr. Mahajan.
A very good morning. Still in Nepal, it's good morning, and hopefully maybe this is good afternoon in Bangkok. Respective Sirdar Sir and Masami Ma'am and all delegates, experts, and participants in virtual conference. I would like to thank on the behalf of Department of Food Technology and Quality Control to present a brief in food safety and quality control system in Nepal. Next slide, please. National Food Safety Policy 2019 and Agricultural Development Strategy 2015 are the main guiding for the food safety and policy in coming days. And the main objective mentioned in the National Food Safety Policy 2019 are upgrading or harmonizing the legislative framework with the international standards and upgrading infrastructure. And also there is objective to enhance the self-regulation or food safety management system in chain and facilitation of food trade and establishment of food epidemiology surveillance system and strengthening inspection and laboratory services, intensifying consumer awareness and conduct research and development. And obviously in agricultural development strategy, which is for 20 years, in coming years, there is clearly mention of ensuring effective coordination among the institutes of the food safety and thought about the Integrated Food Safety Authority. Next slide, please. Since the food safety is multi-sectoral and multi-stakeholder approach, so in Nepal also, there are different departments under the different ministries working on the food control system, and Department of Food Technology Quality Control is the food safety agency. And it is good to we have that the 3 SPS agencies under the Ministry of Agriculture and Livestock Developments, that animal health and disease is taken care by Department of Livestock, food safety by Department of Food Technology Quality Control, and plant health and disease by Plant Quarantine and Pesticide Management Center. And the Department of Commerce is responsible for trade and supply of food, whereas TBT is taken care by Nepal Bureau of Standard Metrology, and obviously the foodborne disease is taken care by Department of Health Service. Next slide, please. The figure shows the organizational structure of Department of Food Technology and Quality Control. And we have offices under department as per the administrative division at provinces and districts. And we have the food import export quality certification offices in the main custom points at the border. There are 12 offices of food import export quality certification office in custom points. Next slide, please. The National Food Control System is based on 4 pillars, that is legislation, inspection, laboratory surveillance, and consumer awareness. The Department of Food Technology and Quality Control is working on upgrading legislation and strengthening inspection, laboratory services, and intensifying consumer awareness. And these are the 4 pillars working to strengthen and upgrade by the DFTQC. Next slide, please. The major act and regulation for food safety and quality controls are mentioned in the slides. The food law and feed law are enforced by Department of Food Technology and Quality Control, whereas Slaughterhouse Meat Inspection Act, Animal Health and Livestock Service Act are enforced by Department of Livestock, and Plant Protection Act and Pesticide Act are enforced by Plant Quarantine and Pesticide Management Center. These are the major SPS acts and regulations. And there are quite a lot of directives and guidelines. Some food-specific directives and guidelines are mentioned in the slide, that the export and import control is based on Export-Import Inspection and Quality Certification System in Nepal 2007. And we have some directives, which is food-specific, like meat product processing industries directives, directives for milk and milk product, directives for processed drinking water. These directives are the regulatory tools to promote the system approach, and these directives are based on GMPs. Next slide, please. The slide shows the major activities which is routinely conducted by DFTQC. The main activities, main programs are food and feed quality control program, where there are inspection and monitoring activities, food industry licensing, export-import certification and inspection, regulation of dietary supplements, and inspection and monitoring of hotel restaurants, and consumer awareness. These are the routine activities of DFTQC under Food and Feed Quality Control Program. The DFTQC also provided the laboratory analysis services. Next slide, please. Instead of regulatory service, the department also provides the promotional programs, that is food technology development and nutrition, food-based nutrition program, training and awareness activities are regularly conducting. And DFTQC are the responsible and communication with international agencies. That is the function of SPS inquiry point is also at the department, and the Director General of Department of Food Technology and Quality Control is the Codex contact point of Nepal and Infosan emergency contact point. Next slide, please. The recent days we have promoted the Nepal GAP certification in primary production, especially in fruits and vegetables. I would like to thank FAO for developing this Nepal GAP scheme in Nepal in last few years. So we have successfully implementing the Nepal GAP certification in fruits and vegetables, and the Ministry of Agriculture and Livestock Development is working on extension of other crops also. The DFTQC also promoting the food safety sticker programs, as mentioned previously in Bangladesh delegates, that we have the sticker programs as per directives based on food safety. And we have 4 categories of sticker that should be issued to the hotel, restaurant, and eateries, especially in highway where the public population are more. Next slide, please. Next slide, please. Some activities on new normal situation due to COVID-19 pandemics. Everybody, including the staffs of DFTQC, need to follow the protocol of WHO and government of Nepal regarding COVID-19 pandemics, especially SMS, social distance, use of appropriate mask and hand sanitizing. We have developed the protocol for the FBOs during the COVID pandemics, and we are disseminating to the all FBOs, and we are promoting this protocol. And DFTQC is providing the service via internet and email during lockdown situation. So the DFTQC is promoting the email and internet services and discouraging the physical presence of clients. And we are promoting the virtual meeting rather than physically presence meeting. So more meetings are in virtual in nature. And we keep the standby, the rapid response team at DFTQC, that we cannot regularly or routinely monitor all the food business operators. So we have keep the rapid response team in DFTQC and offices at under the DFTQC so that we can respond immediately to any complaints regarding food safety and quality. And we intend, we also updating our websites regularly so that people get information from the DFTQC. Last slide, that the DFTQC have priority and way forwards, and that based on the existing policy and strategy, the DFTQC has developed the draft new Food Safety and Standard Act, which is now endorsed at the Parliament. Hopefully we will get new Food Safety and Standard Act and regulations similarly, and we are developing standards and directives and guidelines which are harmonizing with the international standard. We are extending laboratory and extension of accreditation scope of safety parameters, and we are working towards this risk-based food safety inspection and monitoring system, and we are promoting and adopting food safety management system in food chain, and obviously intensify consumer awareness training and awareness programs. Thank you.
Thank you, Dr. Marjan, and again, a very interesting presentation on some of the very active work that's ongoing in Nepal at this time. So very quick question to Dr. Marjan, and then we'll go to the rest of the panel. So obviously you're in the middle of upgrading the legislation, and how do you see the relationships between the various ministries and agencies developing? What is your, with DFQTC in the lead, how does the coordination work with all the other agencies? And obviously this will not be easy, but how do you see that going forward in the future? Over to you.
Thank you, Sridhar sir. This, quite a long time we are drafting this new Food Safety Act, and we have a series of interaction with different stakeholders, and we would like to thank FAO also, that the FAO also supported on public-private dialogue during the drafting of Food Safety Act. After a series of discussion and meeting, then we have endorsed to the ministry, and the different ministry will get comments. So we will forward it to different ministry for the written comment. After getting that, it is endorsed to the cabinet, and from cabinet, it's now in Parliament. Hopefully we will get it that, and this Food Safety Act, we are compliance or taking all kind of principles from the Codex. Thank you, sir.
Thank you, Dr. Marjan. So we have about 30 minutes left, and what we will do now is to have a discussion with all the panel members. So we had the two keynote speakers in the morning, Professor Alan Riley and Dr. Shama Fazur Rahman. And then after the break, we had Dr. Lisa Zabo, Dr. Sabai Tettu, and Dr. Mohan Krishna Mahajan. So we will have a round of questions to all of you. Some may be specifically addressed to one of you, but some may actually be more open to all of you. So we will pick some of these questions which have come from the Q&A, so that those of you who are the participants who are listening can actually get the responses that that you're looking for. Just to say that we are trying to consolidate some of these, so we will not be asking each question specifically, but more in terms of the issues that all of you participants are actually raising through the chat or through the Q&A. So maybe first we'll start one issue that is more relevant to COVID-19 and the concerns over food safety. So Alan, we would just like to go to you briefly and just to ask, despite you obviously through your presentation, you did talk about the guidance from FAO and WHO on food businesses, on food packaging, and the fact that this is not actually food linked. Still, there appears to be a lot of concern that we can see from the chat and from our participants on the packaging of food and whether it can actually carry the virus. So what is the kind of advice that food control authorities should actually be giving to consumers to allay their concerns here? Over to you, Alan.
Thank you, Sridhar. And certainly this is a very hot topic. The potential of the virus traveling on food packaging material, particularly frozen food, and being infectious at the other end wherever it arrives. Look, it is possible for this virus to survive on surfaces, for different lengths of time. If somebody is suffering from the illness and they cough and sneeze on a surface, and they cough out, droplets containing the virus can survive on surfaces. And certainly there have been publications in the scientific press to say that the virus does survive for varying lengths of time on surfaces. Now, hypothetically, if you have a number of individuals in a meat processing plant or a fish processing plant or just a food processing plant, a number of individuals who are infected and they manage to cough or sneeze on the packaging of food, theoretically it would be possible, and then you freeze that food, theoretically it would be possible for the virus to survive. And especially, under frozen conditions, that's how you normally preserve viruses. But you have to think, what is the likelihood of that happening? Number one, the reports that we've seen of the virus surviving on packaging material, is it a living virus or is it just the RNA nuclear material that's been isolated? That would be the first question to ask. The second question to ask would be, well, is the numbers of the virus, would they constitute an infective dose? And then the third question would be, if you do get it on your hands and you happen to touch your nose, your eyes, and so on, like that is a route that the microorganisms are actually spread. If people are not practicing good standards of hygiene, not washing hands and so on, yes, it's theoretically possible for it to happen. But what you have to do is to look at the epidemiological evidence over the last number of months. We're looking at as 6-8 months now of data, and the numbers of instances of that type of scenario happening are very few. I say are nil. I have not seen any reports of that actually happening. When I say reports, there are reports in the media, on social media, and so on. We don't see the reports in peer-reviewed scientific press. So I would say it's theoretically possible, but the likelihood of it happening would be very low. But having said that, the likelihood of it being very low, but the consequences could be catastrophic. I mean, all you need is one person to pick up the illness, and it can be spread, as we've seen, very, very rapidly. So I think we have to turn our attention to mitigation measures. I mean, say in cold stores where staff are handling imported frozen produce, they have to practice good hygienic standards of handling such foods, washing hands, having things like gloves for handling frozen foods, having protective equipment, PPE, and so on, face masks. All of these are key issues to prevent or limit the transmission of the virus. But I think when you look at how the virus is actually spread, and that is from person to person through droplets and so on, when you compare that to the likelihood of it being spread from fomites from food contact materials, it is very, very low. But as I say, it's theoretically possible. Now, does that answer the question, Sridhar? And I would say really the focus has to be with the food industry to ensure that you don't get the contamination into your food premises, to put measures in place to ensure that it's kept outside your doors, and if it does enter the premises, to have a contingency plan for dealing with it once you have infected workers. Thank you.
Thank you, Alan. And indeed, dear participants, as you can see, the emphasis eventually does, at the end of the day, comes down to the health measures that we all know very well with COVID-19, whether it's hand sanitization, hand washing, the wearing of personal protective equipment, the constant use of masks, safe behavior, reducing the surfaces that we touch. These are all vital for the food industry. And therefore, that is indeed, as long as we keep and ensure that these habits are maintained, and not just in our homes, offices, and schools, but also in food establishments, we should be going a long way towards ensuring that the pandemic in some form begins to recede. And that's the lesson that we have learned from many of the countries who have successfully done that. And that includes Thailand, where we are right now. So we will now actually have some of these other questions to some members of the panel. And there's one question, and there's definitely one question which almost all panel members have been asked in some form or the other, and that is on online business, on e-commerce, on food safety online, or when we buy online through apps or through e-portals. So what is so we would just like to hear from some of the countries here on what are some of the measures that are being taken to ensure that the consumers feel that they are buying safe food, or if you're actually implementing any regulations or any measures to ensure that the supply of food ordered online is actually safe. So perhaps we could start with Lisa. Maybe you would want to say something about this.
Sure, thank you very much. When it comes to delivery of food, we certainly do license certain refrigerated vehicles, but they're connected more to the higher risk businesses that we then license. So think of meat processors and the like. Those home delivery vehicles we don't have licensing for, but we did have an interesting conversation with Uber. I imagine Uber's in many countries about the place, so that's one kind of delivery platform, about what they felt their role was in food safety. And they said to us that they did have a role, and what they were talking about then was the businesses that they allow onto their platform. In New South Wales, we have a system for restaurants and cafes where it's a voluntary system, can get a score on door. So that's a rating of the business's hygiene. And Uber were only allowing businesses that got the highest rating of 5 into their system. So in a way, we had this Uber platform and its delivery mechanism driving food safety in the restaurant and cafe sector. So government didn't need to intervene. Of course, there are many other food platforms that are out there. We're fortunate that we haven't seen evidence of foodborne illness outbreaks linked to these. And again, at present, I feel that's because the distance of delivery between someone's home and the business that they're getting the food from is very short.
Oh, sorry, I was on mute. So, Dr. Rahman, can I ask you the same question about online food delivery, app-based delivery, retail?
Thank you, Sridhar. Actually, online shopping is going on in Bangladesh as well, like other countries during the COVID pandemic. And usually the suggestion from the Food Safety Authority as well as the Health Department and other authorities that the delivery man should deliver the food items, keeping the distance, social distance, wearing face mask and other hygienic measures. And the person who actually receiving the item, he or she should also maintain those measures. And the payment, it is better to online payment. It's better if not possible. So the distance should be maintained, social measures should be, other measures should be maintained. This is the suggestion from the government authority and some guide. Thank you.
Thank you, Dr. Rahman. From Myanmar, so Dr. Sabe.
Yes, I think these consumer recommend the product or there's some kind of food posting to another consumer in social media. So one thing is that we can trace or we can make a surveillance on the online so that the consumer among themselves can have recommendations or whether this is good or this is not good, or that is one source we can get the information. And another thing is that I think every food business must be registered with the relevant government authority, competent authority, so that we can trace back the food business, food business and industry. And also Myanmar is currently working on the new revised the food safety law, and every food business must be registered and with the relevant government, including the producer and the transporter, repackaging in the food chain, the whole food chain systems. So I think one thing is every food business must be registered with the competent authority, and we can make a surveillance online what people, the consumer, have recommended or between each other. Thank you.
Thank you, Dr. Sabe. So, Dr. Mahajan, in Nepal, is this one of the issues that are being considered as you look at the legislation and regulations?
Thank you, Sridhar sir. Obviously, that this online food business is just started in Nepal because it's not much common, but it started in some urban areas, especially in Kathmandu Valley, but not in other remote areas. But they have to register in the local government, especially in a municipality and metropolitan city. They have to register, and they have to follow the standards of prescribed by the DFTQC as per food law. And they have to follow the protocol of COVID, especially that SMS, because last time that is the issue that the government authority, the administration authority has stopped the business that initially, but it's few days back after it's reopened again. Now it's going on, but they have to follow the protocol of COVID-19 pandemics. And we always open for the complaints of these kind of foods, and there are different mode of handling the complaints. That's Hello Sarkar like that, and we have also the rapid response team, and we have a point of getting the complaints from different offices under the DFTQC. So in that way, we are monitoring that. Thank you.
Thank you, Dr. Marjan. So we'll probably again, since you are there already on screen, maybe we'll go in reverse from you, starting with you again. So you did mention, this is on a different topic, and again, this was raised by almost all the speakers, and there are more questions about it. This is about the restaurant grading system. How do you see, how does it work? And do you actually see this as a major boost to food safety rather than having codes of practices and for good hygiene for all the registered businesses? How do you see this grading system actually working?
Thank you, Siddhar sir. Obviously, it is very visibility activities of DFTQCs that we have started it as a sticker program. We have a directives for that, and by that directives, we have getting the score system as mentioned in last slides in Bangladesh, as we have also seen in different indicator. We have 20 indicators for them, and around 100 scores are there. Based on that, they will get. But there are quite a lot of food eateries and hotel restaurants, so it's very difficult to coverage monitoring regularly by DFTQC. So we are coordinating with the local government and the association of the food business operator in the local area. So we will have a team over there, and first we will start to make awareness and what is the requirement, and all this awareness and training activity first we conducted. After that, there will be a team will be there which is regularly monitoring in the local level, and the member secretary will be our food inspector, and the other stakeholders will be there, where there will be security personnel representative will be there, local government, the representative will be there, and the private sector and consumer, the different representative. There will be a team in the local level, and they will monitoring regularly. And after getting training and the monitoring, then we will issue the sticker, and it will be regularly monitoring by the time, because it's 3 months, 6 months. If the FBO says that we want to be upgrade, because there is a 4 grading level are there. If they upgraded, then they will request. Otherwise, we monitoring regularly, 6 monthly or yearly like that. So based on that, we will upgrade it, and we focuses more on the highway where the public bus are passes by there. So these area we focuses more in the highway rather than in the other areas. We focus on that. We have not completed it. We have focuses in the very highly density populated area. We are growing it day by day. So in the coming days, we will be coordinate with the local government. Now it's the local governments are very powerful. They are now, and they have a authority to monitor also the food business also. So in coming days, that the local government will take care, and then the technical backstopping will be provided by DFTQC in coming days. Thank you.
Thank you for elaborating on that. Indeed, you raise an important point. Asia, as we all know, is very densely populated. There are thousands of various kinds of restaurants all around us, and ensuring that they all actually follow good hygiene practices is not an easy task. So, Dr. Sabai, how are you approaching this? Because you also had described a similar approach in Myanmar.
Yes, we also have a project for the street food, and the first phase is we give the education, lots of the education to the shopkeeper, and then after they receive the training, we giving them some sort of the recognition certificate so that they can stick at the restaurant or at the shop, so the consumer can recognize and differentiate it, which restaurant has been achieving or having the training from the government authority, so that they can make a choice for the restaurants. And also we also have make a pamphlets, and also the what can I say, the statements, so that every restaurant has to be put that pamphlet in the restaurant, so that every consumer can see the requirements and the principle to follow by the restaurant and also to the consumer. So at first, we are focusing on the major populated area, that is the Yangon, Mandalay, and Namibia. And in coming years, we're going to extend the project to the other state and regional area in Myanmar. Thank you.
Thank you, Dr. Sabai. So already lessons to be learned here from Nepal and Myanmar. In Bangladesh, Dr. Rahman, how do you see the system operating?
Oh, yes, thank you. Actually, it works in Bangladesh. First, I should mention that this is not mandatory. First, we have developed the restaurant guidelines and checklist for audit. We orient the restaurant manager as well as the food handlers. If they are prepared themselves, then they participate in the process. And based on the report, inspection report, audit report, they are graded in A, B, or C, what you have seen. And this is for a year period, 1 year period. And in between, there are regular inspection. And based on the inspection, it may be upgraded or downgraded as well. So it works, because seeing the green sticker and other sticker, the customers are very much interested to use that restaurant or catering service. So business are going up those restaurants. So it's work actually. Thank you.
Thank you, Dr. Rahman. So Lisa, can you walk us through some of this in New South Wales? Many of the comments actually talk a lot about how you actually maintain the very high standards that you do. So maybe this could be a useful experience to share with many of our listeners.
Well, our approach is very similar to what other speakers have spoken about, which is, I suppose, shows the unity in food safety globally, that we have strong approaches and strong commitments to it. Restaurants and cafes in Australia have to notify to a responsible authority, and that's mostly local government, and they are inspected. So in New South Wales, as an example, there's probably around 40,000 restaurants and cafes, and our local governments do about 60,000 inspections a year. We've heard about training. Again, different states in Australia will mandate a level of training. New South Wales has done so. It's called the Food Safety Supervisor, and it asks that every business does have a food safety supervisor, and it's their responsibility to be able to train other staff. Our food safety supervisor lasts for 5 years, then the supervisor needs to do a course again. Or we've also introduced specified modules. So we look at our risk data, our foodborne illness data, and we try to pull out from that what are some of the contributing factors. And so we build modules around that. egg food safety has been an issue in this sector for a while, same with cleaning and sanitation. So we've got specific modules so a person can come back and get updated in certain areas. Now that food safety supervisor concept is about to go out nationally and for consultation as to whether it would become a national food standard, which I think will give consistency across the nation. Like others, we have a scores on door system. All councils have got the same inspection checklist that's got certain weightings on it, which in the end will come out with a score, and a business can get it's a 5-star rating system, basically, with 5 stars being the highest. Now, that's currently a voluntary system in all states and territories in Australia. Not all people are using it. As I said, in New South Wales, we've probably got about 65% of the businesses voluntarily using scores on doors.
Thank you, Lisa. And we are almost close to the time that we had allocated for this session. So I will quickly wrap up and then pass it on to Masami for housekeeping and then to announce about the next webinars. So we started out this morning actually by looking at food control system at a high level, what they actually involve, what are the competencies actually required and the elements, and then what are the changes that COVID is actually bringing into the way that food control is exercised. We then looked at some very good country examples in the Asia Pacific region and they're all in various stages of transition, but all of them had very interesting lessons to share. And we then finished the conversation just now by talking more about from the consumer point of view, that is on consumers eating out in restaurants and then in online retail and e-commerce. So in a way, we have looked at various parts of the chain, probably not in as much detail as we'd have liked to, but then we could actually talk about food safety all day if you want us to do that. So at this point, I'd like to first thank all the two keynote presenters, and then Lisa, Sabe, and Dr. Marjan, and then earlier Alan and Mahfouz, for their excellent presentations, for being here all through with us at various hours. And I'd like to thank all the participants who are here. We look forward to seeing you again in the next sessions. And let me say this, that this will only get more interesting as we go along. So over to you, Masami.
Thank you very much. Many participants asked us if they can get the presentation files, and then I have been informing that as long as presenters agree that we are very happy, we are planning to provide a link for the registered participants to be able to download the presentation files, and we will provide the link to the YouTube recorded file so that you can review the webinars, and then also that the Q&As that we are not able to answer all the questions, but then our aim is to answer all the questions in the final report, which is to come. So please just don't feel that your questions are unanswered, but then we will make sure to check all the questions, all the comments from all of you. So just wait for the final report if you don't see the answers here. And then now that the next session, the second session, is at the same time on Thursday this week, 19th of November, and then it is about evidence-based food safety management and risk-based approaches. So we will be talking about some science, and then also we have some innovative approaches that the people are using, and the various country representatives will be invited to discuss further about this food safety management. So now that I am going to say goodbye to everybody, but then before going to say goodbye to all, I would like to show you one more wonderful video that you will really like it, because this final video is from the Cook Islands, so one of the Pacific Islands. And enjoy the video, and then we will all see you again on Thursday. Thank you for joining.
The steadily growing population of tourists and visitors to our islands during the past 5 to 10 years has also increased the demand for fresh produce, in particular fruits and vegetables. This demand has also brought about some challenges as farmers try to increase their use of inorganic pesticides and fertilizers to try and maintain or manage the level of pests in their crops. At the same time, to try and maintain the level of nutrition in the soil in order to maintain a high yield. Over the last 4 to 5 years, through our training programs to make farmers more aware of the many benefits of organic pesticides, we have seen a 20% or even more in some cases of the use of organically based pesticides by our farmers. We continue to see this positive trend where more and more farmers are using organic and biologically based pesticides. We also promote the use of other methods of managing pests in crops, including adjusting of spacing, using machinery to manage weed problems, and also hand weeding where possible, where farmers are able to utilize these means which are non-chemical. The ministry, together with the financial and technical support of the Food and Agriculture Organization of FAO, was successful in implementing a project at enhancing crop production while at the same time improving soil resources management for sustainable livelihood. The project largely focused on improving soil resources management through increased use of organic matter, use of cover crops, and minimizing soil tillage. Farmers were trained on the importance of improving soil health in order to improve the tolerance or in order to increase the tolerance of their crops to pests and diseases. Currently, the ministry is working on a project with FAO and also the Secretariat of the Pacific Community, a regionally based organization that works together not only with FAO, but with other donor partners and other implementing partners on many agriculture projects. The current project will help us look into our legislation and how we can improve our legislation to try and address the current issues, in particular around the importation and use of pesticides, especially moving towards looking at safer alternatives or alternatives based around organic pesticides and biologically based pesticides.